Saskatchewan has the worst new HIV diagnosis rate in the country. It sits at 19 people per 100,000. The national rate is about 5. A rise like this in new cases hasn't been seen in more than a decade. Community organizations say they're worried about people who need testing.
They sent an email stating that they are hearing that funding will be lost for these self-test kits.
Danielle says that email came from Nexus, an organization that provides HIV self-testing kits across the country. The funding for those kits comes from the federal government. She says without those kits, there could be an increase in cases of HIV because it could be spread by people who don't know they have it. Other advocates say the stigma and discrimination associated with HIV makes it difficult to diagnose.
This is not a clinical setting that they're going to. It's a community-based organization on Treaty 6 territory and the homeland of the Métis. And the people that work here are Indigenous people with lived experience of either having HIV or having a loved one or some kind of contact that it has affected their lives.
Barton says meeting people where they need help is important, and clinical settings may not provide what feels like a safe environment.
We have found that people are anxious about accessing a clinic setting for fear of judgment, especially people who live out of town who see their regular doctor everywhere and they have a pretty good relationship with them.
The Public Health Agency of Canada wouldn't confirm if funding is going to be available after March 31st. In a statement, it says it's continuing to explore options around making kits available to community organizations. Ashwarya Duda, CBC News, Saskatoon.